Hello and welcome to this week's hot topic, which is about removing the glass ceiling effect within health and social care. And the reason I'm doing this is I get asked a lot of questions around what's the purpose of this, what will I gain, what can I do at the end of my training? And I get a lot of questions about how can I become a nurse or how can I become a doctor, etc. So let's break this all down. The doctor question is a little bit out of my range because I'm not a doctor. I haven't gone to medical school. However, if you want to be a doctor, there are different routes into being a doctor now. So, for example, there is a level 7 physician's assistant, which is an apprenticeship. You could train up to do that, and then you could do a top-up degree into becoming a doctor. But again, have a look at your local medical schools because they'll be able to give you more information. But just think about the cost and think about pathways in. So if you can get a vocational pathway in, it's going to be much better for you because you're learning at a slower rate and it's not going to cost you as much money to train up. Now, let's think about becoming a nurse. Now, there's lots of different types of nurses: mental health nurses, learning disability nurses, children and adult nurses. All of them require a degree from a university. So your first step is, how do I get that degree? So there's 3 or 4 ways that you can do this. There's the traditional way where you get your 5 GCSEs in English, math, science, biology. You go to UCAS and you apply for your 4 or 5 universities and you go for interviews and you're selected. The second way is through your level 3 pathway. So, for example, you've done a level 3 qualification, you've got your functional skills. Again, you apply to UCAS and you go in and you do your university choices that way. The third is that you could do it as an apprenticeship. So you could do an access to nursing course, not an access to nursing course, sorry, a nursing course as an apprenticeship. So you could go to an NHS trust, apply to be an apprentice, and you would do your nursing degree that way. The other way is to apply through a process called clearing. Now, clearing looks at your history and it's a much faster process. It's normally you fill up empty spaces and as long as you've got the right qualifications and the right background experience, they'll take you on board. So there's lots of different ways in. Now, the alternative way in is that you've already got a degree. If you already have a degree, you can do a postgraduate course, which is then a 2 years program, so it's a bit quicker. Or alternatively, there are some universities where if you complete a level 5 program, they'll RPL the first year off because a level 5 is equivalent to your year 2. And if they RPL that first year off, then you've only got 2 years to do as well. So there's lots of different ways in. Now, to get your first level 5, you could do that as an apprenticeship. So with your current employer, you could do a level 5 program, upskill yourself, and then apply. So that way it's not cost you anything. When you think about the debt in which people are walking away with, which is roughly between 60 and 80,000 from their nursing degree, that's a huge amount of debt, which ultimately could be avoided if you choose an apprenticeship route. So just bear that in mind. You don't all have to go down the formal way. Now, what's interesting, nursing is changing because we've left Europe. Different models of the degree are coming out. So, for example, if you look at Bangor University, they're doing the first online nursing degree and have been doing that now for the last year, which has been going really well. And I'm assuming that's going to happen in England as well. So there's going to be a bit more flexibility around this. So just think about how you want to get to that first building block. Now, that first building block could be achieved through other means. Again, it's going to be important that you talk to your universities about the qualifications, your apprenticeships that they will be looking for. Now, let's just say you go, look, I don't want to be a nurse, but I still want to have a profession in health and social care. I want to have a profession. And why wouldn't you? You're working in health and social care, you deserve to have a profession. So there's a couple of other options. So option 1 is you could become a registered manager. And the registered manager, you would normally become a team leader, supervisor, deputy, manager. And again, you do your level 5 program, you get your registration done. Once you've got your registration, you can then go up. So after your level 5, you could do a level 7 senior leader qualification, or standard, sorry. And off the back of that standard, you can apply to the Institute for Leadership, and that will give you letters after your name and a professional title. So great way into management, great way into leadership, and a great way to get a master equivalent qualification. So there's that pathway. You may say, well, actually, I don't want to be a manager, but I quite enjoy talking to people. Well, why not become a learning and skills mentor? Off the back of your learning and skills mentor, you, as an apprenticeship, you can do a level 5, which is your diploma in education and training. Off the back of that level 5 diploma in education and training, you can go to the Society of Education and Training, and you can get what's known as QTLS, your qualified teacher status. Therefore, you become a recognised teacher in England. So a great way to get a recognised profession there. You may go, that all sounds good, not necessarily for me. I'm a bit of an eye for detail. I like scrutinising. I like the detail. I like compliance. So if you like compliance, there's a quality improvement leader route. You can get membership through CIPD. And again, through that level 6 route, you could do that as a degree, as an apprenticeship. And again, similar outcomes there where you can get letters after your name. So if you're thinking, that all sounds a bit great, but I don't know if I want that leadership role, but I want to do something different, then we have the level 3 community health and wellbeing practitioner. And the community health and wellbeing practitioner is all about something that's signposting people, something that understands that you don't need to give a tablet to solve every problem. So you might be looking at social prescribing, you might be looking at using therapy to help somebody to understand their thoughts and feelings, manage people in crisis. It might be the fact that you're trying to get people the right help for their health and well-being. And that might be for your staff or the people which you look after. So there's a great qualification there as well. But what I'm trying to demonstrate here is if you are looking for a profession and you are in a care home or a residential home or domiciliary, it doesn't have to stop with you being a carer. Don't just leave your organisation because you feel you're not meeting your optimum within your own development. There are multiple pathways that have come out. They're all relatively new. And just think about how you can use these pathways to shape your career within a field that you're in. Because there's a great phrase, which is the grass isn't always greener on the other side. And sometimes what we need to do is tend to the grass under our feet. And if we stay where we are and we look after the grass under our own feet, we'll grow and flourish a bit quicker. And again, if you do a different apprenticeship within your field of care, you're going to be more confident because you're around the same people, you understand your systems, so you're halfway over this hurdle. So if you are thinking about leaving the care sector because you want to upskill yourself, I would recommend you to think again. Have a chat with a training provider, have a chat with your manager, look at the different options that are there. There are many different pathways in health and social care that you can go down, from being a qualified teacher, qualified quality improvement lead or an inspector, to being a home manager, to being a nurse. And there's a pathway there for everyone. And if we can all follow those pathways and we can all follow our dreams, then hopefully we can retain our staff a bit more. And that ultimately has a better outcome for the people that are using our service, because if we can retain our staff, we get continuity of care, which is the reason you went into care in the first place, which is to look after the people in which need your support. And therefore, it's a win-win for everyone. You get to upskill, you learn a new strand or a profession, and the people in which you started to care for continue to be cared for and continue to have that continuity of care. Anyway, I hope you found that useful. I hope it's given you something to think about. If you want to know more information, please do just reach out to me and I'm more than happy to explain it to you. Take care. Bye for now.